Good evening and thanks for joining us tonight. We begin with the American Rescue Plan. It's the COVID relief package you've been hearing so much about. The bill passed the Senate on Saturday narrowly, 50 to 49, and went right down party lines. The package would spend $1.9 trillion. It's a big price tag. Let's go through some of it for you. Some rough numbers here. 22% of the money would go directly to many of you in the form of those $1,400 stimulus checks. 13% of that money would go to extended unemployment benefits. 12% would help with health care costs. We're talking COBRA and Affordable Care Act subsidies, as well as nutrition assistance, grants to small businesses, as well as the airlines who have avoided layoffs. About 9% of all that money goes to vaccines, testing, and medical equipment, as well as child care for essential workers. 27% of this pie would go to state and local governments. Some goes to schools, some goes to make up for budget revenue losses blamed on the pandemic. Now, the bill still needs approval in the House. Votes on it are expected tomorrow. Passage would be the first big legislative win for the Biden administration. And earlier today, I spoke to White House Press Secretary Jen Psaki.
Jen, I really appreciate you making time to talk to us. Let me start with this. How disappointing is it that no Republicans went along with the vote on Saturday?
Well, first, we're pretty excited that we're about to sign into law. We're on track to sign into law a $1.9 trillion package. That's sure going to get a lot of relief to the people of North Carolina. Of course, we would have preferred for it to be a bipartisan package, and the president leaves the door open to working with Republicans moving forward. But he wasn't going to allow those negotiations to delay getting relief out to the American people.
There have been some estimates that show that about 15% of this plan is for policy priorities that are not COVID related. Why put those in this bill?
Well, it's always a negotiation, Jamie, right? In order to get a bill passed. But I would say our estimates are more than 90% are committed to and dedicated to getting direct checks to the American people, to people in North Carolina, to ensuring that people of North Carolina and states across the country are not cut off unemployment insurance, to reopening schools, and to getting more vaccinations in the arms of the American people. And that's why more than 70% of the public has supported it. So that's really what the bill is focused on.
Senator Tillis here in North Carolina voted against the plan. He is saying that there is still $1 trillion unspent dollars from the previous COVID relief plan. Is he right about that?
Those numbers don't jive with my understanding of the leftover funds. Most of the funds, if not all of them, are allocated and dedicated to programs that are still going out the door. But I will say, I don't think anyone in North Carolina thinks that we're at the end of this pandemic or at the end of the economic downturn. And a lot of people in the state, a lot of schools in the state need the assistance that's in this package. So down the road, and that's why we push so hard for it.
Well, if vaccines will be available to everyone by the end of May, as the president has said, presumably we'll see some improvement in the economy, hopefully fairly quickly. There could be an argument then, why not wait a little bit, do a smaller package? Let's see what we're facing come summer.
Well, I think most of the 10 million people in this country who are out of work would tell you they can't wait for the direct checks. The 11 million Americans who are almost at the end of unemployment insurance, ability to apply would tell you they can't wait. And if we want to reopen schools and get to a point where we're reopening the economy, we need this money now so we can plan, so we can invest, so we can take the steps now to get us through this period of time.
On the vaccine rollout itself right now, we know there are people still reluctant to get the shot for various reasons. Now, the president has said he hopes life returns to normal by the end of the year. Does that message need to be more optimistic, give more people a reason to get the shot?
Well, it's such a good question. And Jamie, today the CDC put out some new guidelines that made it clear that if you have a vaccine and your wife has a vaccine and your neighbors have a vaccine, that you can have dinner with them inside together. Now, we realize everybody is not eligible quite yet, but in the coming months, people will be. We'll have enough vaccines for every American. And so that incentivizes, we hope, for people to get the vaccine. That's not the reason they did it, but we're hopeful that will be part of the impact.
We're all looking for normalcy in our lives, no question about that. Jen Psaki, White House Press Secretary, thanks for your time today.
Thank you.
And we're